Today, we're covering something that could, no joke, save a life. By the time we're done here, you're going to have the knowledge you need to see the signs of a stroke and know exactly what to do. So, let's jump right in. Okay, first things first. A stroke isn't some slow, creeping illness. It's an ambush. It is a sudden, all-at-once attack on the most important organ in your body, the brain. And that surprise factor is exactly why we all need to be ready. So what is actually happening inside the brain during one of these attacks? Let's break it down and get a really clear picture. The easiest way to think about it is as a brain attack. You know how a heart attack cuts off blood to the heart? Well, a stroke is when the blood supply to a part of the brain gets shut down. And without that oxygen, brain cells start to die fast. That's what causes those sudden problems. And that's why getting medical help isn't just an option, it's everything. Now, these brain attacks really come in two main flavors. The most common kind is called an ischemic stroke. Think of it like a clog in a pipe. A blood clot blocks a vessel and cuts off the flow. The other kind is a hemorrhagic stroke, and that's when a blood vessel actually bursts and bleeds out into the brain. So you've got a block or a bleed. Either way, it's a major crisis. All right, so how can you, from the outside, spot one of these attacks happening? This is the most important part because this is where you can actually make a difference. Let's get into the signs. And if there is one word I want you to burn into your memory from all of this, it's this one: sudden. These symptoms don't build up over a few days. They hit like a lightning strike. One moment, a person is totally fine, and the very next, they're not. So what are these sudden changes you're looking for? Well, a huge clue is that they often happen on just one side of the body. You might see sudden weakness or numbness in one arm or one leg. Or they might start slurring their words or seem really confused. Maybe their vision goes blurry, or they suddenly can't walk straight. And another big one is a sudden killer headache that feels like the worst pain of their life. Any of those are massive red flags. Now, believe it or not, there's this one really fascinating, kind of weird clue that can help you zero in on a stroke. And it's all about the forehead. So let's say you see that classic sign. One side of the person's face is drooping. But then you ask them to raise their eyebrows, and they can do it just fine. You'd think that's kind of weird, right? How can half their face not work, but their forehead is totally normal? Well, it turns out there's a brilliant neurological reason for it. It all comes down to a fancy term called bilateral cortical innervation. But don't worry about the name. All it means is that the muscles in your forehead are special. They get their instructions from both sides of the brain. So if a stroke knocks out the signal from one side, the other side can still pick up the slack and get the job done. The lower part of the face, it doesn't have that backup system. And that little piece of science gives us a super simple two-step test. First, ask the person to give you a big smile. That's when you might see the droop on one side. Then ask them to raise their eyebrows, like they're surprised. If that smile is lopsided, but the forehead wrinkles up perfectly fine, that is a massive clue you're looking at a stroke. Okay, so all of this brings us to the single most important tool you can walk away with today. It's an acronym that spells out your action plan for what to do in a potential stroke emergency. You just have to remember the word FAST. F is for face. Ask them to smile. Look for that droop. A is for arms. Ask them to raise both arms up. See if one of them starts to drift back down. S is for speech. Have them say a simple sentence like, "The sky is blue." Listen for any slurring or just strange-sounding words. And then, the most important one, T is for time. If you see any of these signs, even just one, it is time to call 911 immediately. No hesitation. And let's just focus on that last letter, T, for time, because honestly, it's the whole ballgame. It is the one thing you cannot afford to waste. Look, when a stroke is happening, we're talking about millions of brain cells dying for every single minute that blood flow isn't restored. There is no wait and see. There's no let's see if you feel better in an hour. Every second you wait can be the difference between a full recovery and a permanent disability, or even life and death. So let's just put it all together one last time. A stroke is a sudden neurological problem. You're looking for that one-sided weakness, that weird facial droop where the forehead still works, any trouble with speech or vision, or a terrible headache, and your one and only job is to act fast. So there you have it. You know what it is, you know what it looks like, and you know what to do. You have the knowledge now. The only question left is, if you saw these signs tomorrow, would you be ready to step up and act?